Transforming generations, changing lives, building healthy families. This is the campaign for a healthy Houston.
At Legacy Community Health, we have incredibly dedicated, caring providers who've been driving change in our communities for 35 years. We started as a single clinic in the Montrose, and now we've grown to over 22 locations, including our school-based clinics today. Through the Building Healthy Families campaign, we will have an opportunity to expand our comprehensive services in two of our fastest growing communities, the Gulfton area of Southwest Houston and the 5th Ward.
I would say the Gulfton area is very culturally diverse. The families there, although working, were underinsured or not insured at all. Legacy responded to the needs of the community, and we were one of the first clinics to provide access to the quality health care that these patients need. We have grown tremendously over the last 5 years. We have been challenged to keep pace with the demands of providing those services to that community right there where they are.
To meet the need in Southwest Houston, Legacy is operating out of 4 locations. In addition to primary care and OB-GYN services, our Southwest clinics provide behavioral health, dental care, educational programs, and nutrition counseling. There's even a pediatric walk-in clinic open late and on weekends, so parents don't have to miss work. The Building Healthy Families campaign will bring all of those services under one roof.
There are about 300 babies born a month. It's important that we invest in them. They're our future. And we can invest in prenatal care for their mommies before she gives birth to her child. And then once the child is getting ready for school, there's opportunities for immunization and just total health care for the whole family.
Well, when I first found out about Legacy, I was 19 years old. I was pregnant. I was so scared just having the idea that I was gonna have a baby so young, no job. I had just graduated from high school. Legacy was able to help me with everything. Well, during my pregnancy, I was encouraged to go back to school by my provider. Went back to school for medical assistant. And I went to Legacy to apply, to give my resume, and a week after I was able to, become an employee. So I'm practically the person that helped me first when I first got to Legacy. I needed that help, and I know they need that help also.
Legacy is more than just a place to see a doctor. We are an integral part of the neighborhoods we serve. Our providers offer more than just a simple diagnosis. We take care of the entire family right where they live.
To the northeast, in Houston's 5th Ward, Legacy Lyons also offers a full suite of healthcare and educational services. The facility is leased from the City of Houston, and a new permanent building is needed to serve an increasing number of patients. The 5th Ward has higher rates of healthcare issues, from obesity, diabetes, and behavioral health issues to low birth weight babies, than any other place in Houston and Harris County. Little Ali was one of those premature babies. Born 18 weeks early, he spent his first 4 months in intensive care. Now, at 2 years old, Ali is much healthier and a part of the Legacy family. Dr. Jones and care manager Amy Puente have been his special medical team, coordinating complicated medications, oxygen treatments, and other special therapies for a variety of illnesses.
I needed to find a clinic close to home that could take care of a premature baby. Legacy was able to provide those special services. Anytime we need something, I know Legacy will be there. Amy is just a phone call away with answers, and Dr. Jones is on top of things, watching out for whatever Ali needs to grow up healthy.
In the past 6 years, the number of patients seen at Legacy's Southwest and 5th Ward clinics has tripled. Through the Building Healthy Families campaign, Legacy can expand its medical, educational, and social services in these critically underserved areas. The clinics will have 60 full-time healthcare providers on staff. The additional space and improved patient flow will allow us to serve an additional 35% more clients.
Today, what we're talking about is a capital campaign to raise money to have a nice building where we can put all of this under one roof. No one can have the capacity to give the service that Legacy does without the support of our community.
Making a donation to Legacy's capital campaign does more than give people like Aurelia and Ali the care they deserve. It ensures that thousands of Houstonians will live healthier, productive lives for generations to come. Please consider investing today for a healthy Houston.